will not be able to make it.
Be
Okay.
able to make it. Okay.
So let's just wait for Dr. Bonini at least. I know she's planning to join us.
Join.
Is anybody getting an echo? I'm getting an echo. No. Okay.
I'm not, but I'm going to mute myself. Sometimes that helps.
All right. Well, we're hitting 7 minutes, so maybe just to be respectful of everybody's time, maybe we can start. What I thought we'd do, obviously, so we're planning for this to be the last meeting. If anybody would like, we could certainly try and squeeze in another meeting, but that's the current plan. So please speak up if you would like to squeeze in another meeting between now and January 1st. So I thought what we could do is just briefly look at our remit right at the beginning, because we've had lots of conversations and just as a reminder. So I'll just share my screen if that's okay. Okay. Can you see this Word document that says population data at the top?
Yes.
Okay, fantastic. So, and you'll see there are 9 items, and I've just kept the original numbering, so 1, 2, etc. But they're in a different order because we grouped them based on grouping that made sense. So issues related to population health, policy interventions, and reducing disease burden, creating structures, increasing awareness, and then treatment. And this was the one that we discussed at the last meeting. So, these were our the topics we were given to discuss. And clearly they were generic, right? They were not, specifically designed for NASH. And also they were very general. Um, and as we can see, one of them is the incidence of such disease in state compared to incidence of diseases throughout the USA. So they were generic and somewhat general. And the reason I'm bringing that up is that, it gives us a challenge that at the end of it, we do want to try and give as much as possible concrete recommendations as well. But for some of these areas, there's going to be a gap in between what we would like to achieve and the concrete steps that we're able to provide as to what needs to be done. So this is where we started off. And then this is where we have ended up to date. So meaning these are the recommendations that we have. And of course, you're all familiar with them. You've had them. Well, we came up with them. And what I did do, and I just did this on a piece of paper, is to see if we went to the original topics that were to be addressed, did we address them with these recommendations? And the answer is yes. And I can go through them step by step if you would like. But it gets a little tricky because we sort of need two documents at the same time to look at them. But for all of the 9 points that were given at the beginning, these 11 do end up addressing those. So there were no points that are left completely unaddressed. So that's sort of one aspect of it. The other aspect is, I did share this with our uh, public health director, Dr. Manisha Jitani, just yesterday, I think I shared with you her response, and that's obviously extremely helpful and very important. And I'll just put this up. I'm not planning to read through all of it. We certainly can go through some of it if you would like. But what really comes across to me from her comments, that her comments are not surprisingly, focused on very practical questions. That if we're proposing, for example, screening for liver fibrosis, which was our second point, then it's a question of, well, then what will we do with the information? Which is a perfectly reasonable point to raise, that if we do start screening, but if we go to one of the issues that we were asked to address here at the moment, is simply, to address the issue, what is the incidence, right? for example, the first line. So, my feeling is that by recommending screening, at the very least, what we will achieve is get an incidence for these diseases, particularly in the populations for which we know that they're overrepresented in. But what else we will do with the data in terms of actually acting upon it, I think is still an important issue. So I just wanted to point, I guess the point I'm trying to make is that we started off by, we were given 9 fairly conceptual kind of questions to address. But then when we do come up with recommendations, it's very reasonable for other people to then come back to us with very practical things like, well, what will you do with the information? So I think it's fine. I think we're sort of in the in between stage here. Um, so I just sort of wanted to share that and see if anybody had any additional thoughts on that. I mean, to take that one step further, I think it's beyond our ability to, for example, these make these 11 recommendations and populate them with practical steps as to exactly how all of them will be achieved, right? I mean, we clearly can't do that based on our working group. But I found it was very helpful to get that sort of feedback because it forces us to think about that. So, regarding the specific issue that was raised here, oh, hang on, get the right. The specific issues that was raised here in terms of, well, if you do screen, so what? Um, at the low-hanging fruit will be, well, at least we will know what's happening. And then obviously, but then what else we will do with the data is extremely important as being applied. And I think what it does is it forces us to really think in a more concrete way, which is extremely important.
I have a I have a question. Are you thinking of taking the recommendations and putting them into this, see the screen you have right now that has
Hmm. Hmm.
the one, two,
Yep,
three.
yep.
Are you thinking of taking those recommendations and putting them where they might apply so that it's easier to follow for when it gets submitted? I'm just,
Y- Yeah, no, I think that's an excellent point in terms of organization. The
yeah,
issue is that the recommendations apply to several of these questions.
yes,
So, for example, the screening recommendation would apply to one, would apply to answering two, um, and frankly, it would also apply to seven, because simply by screening
yeah,
and identifying somebody who has fibrosis, we and how we provide that resource obviously is open to question, right? But if we are able to do that, in some ways we have taken away the affordability barrier for someone who has a disease and otherwise wouldn't even step into a doctor's office to find out how sick they are, basically. So, so I could do that. What I was thinking instead was, to have a separate document for all our recommendations, and perhaps underneath here, just reference them, reference recommendation 3 or recommendation 4, because
yeah,
they will pop up in multiple of these.
that
Excuse
makes
me.
sense. Just, that sounds great. Just to make sure we're
I have a question.
cross-referencing.
I have a question about the data and kind of the next steps. Once a person is screened, does that data automatically go back to the primary care physician, or does it appear in Epic at all for treatment purposes?
I mean, all excellent questions. So these are sort of operational questions as to exactly how that, we would undertake such a screening. And I don't know if at this stage we want to do that operational work.
I
I mean,
see. Okay.
there'll be obviously many, many operational questions in terms of, you know, how many staff we might have, what screening modality would we use, would this be entirely research, would the patients be informed? There are certainly dozens of questions around that. Um, and I could flesh that out a little bit, but to really prepare a document to the
Mhm.
point where we could initiate it would be quite a significant document at that point. And I think, probably would, well, not probably, it would definitely require input from people who are not part of our working group. Just as the four or five of us, I don't think we could really propose something which would fly with, many different state officials.
I see. Okay. Guess we should leave it as is.
I think so. I mean, I could try and flesh it out a little bit, but I think that would almost need to be a separate group of people who would actually say, okay. So, there's the funding aspect of it, but if we assume that that's separate, simply to even come up with a working proposal is not a minor thing. I mean, we could do it, but I, you know, okay. So maybe what the other thing we could do is we could look at the gaps. We could look at areas that we were not able to really address at all, and sort of looking at this. I mean, clearly insurance coverage, I think, is an area which, frankly, I don't think any of us can really, um, or any of us have any practical recommendations for. Um, and I feel like the patient advocacy and support networks. Um, So Dr. Benini and I actually had a call with the leadership of the American Liver Foundation. There were four or five of their staff on the call, including their CEO. And they're very interested in working with us. So I think, and they took our recommendations. They said they would get back to us before January 1st, with further input from their side. We were hoping they would get back to us by today. They haven't been able to. But we'll see, what they say. But clearly aligning with a national organization related to that, not related to, but kind of existing for the purposes of liver health, makes all the sense. And they also have a NASH day. And what they've been doing is actually they piloted, I believe it was 6 or 7 states where they piloted sort of a NASH day where they went out and they reached out to many constituents and had advertising. So they already have materials. They have slide sets for various, non-professionals to use to teach about this topic. So, merging with them, I think makes all the sense. It's just that, we had one conversation with them about a week ago, and we just haven't had time to actually, fully bring all those materials to you. But as you know, we had discussed having a liver health day for Connecticut, which everybody seems to think is a really good idea. And syncing that with the American Liver Foundation, I think is a very, very obvious thing to do. Okay. Um, so there are those aspects. And then let's see. So Allison shared, some very detailed information regarding nutrition. And I'll just put it up here. I don't think we need to go through it in any sort of detail. Um, I'll s- I just received this, so I apologize. I didn't get a chance to share it. Um, but I've shared it with all of you by email. Uh, so if you have any additional comments about this. So this was related obviously to nutrition. It was mostly focused on children. And, she's highlighting some of the top fructose sources, particularly because, fructose is a particularly dangerous sugar as far as fatty liver disease goes. And then she's sort of gone through and listed ideal things. So what I'll do is I'll maybe add that as an appendix to our recommendations, because we did say that, we agreed that we would like to highlight fructose as a particularly dangerous sugar that's, far too prevalent in our nutrition. And I'll highlight this work or that she's done in identifying exactly which items have high fructose. Okay. All right, I'll maybe pause here and see if anybody wants to bring up anything else. Okay. So if it's okay, then what I will do is, Dr. Benini and I will sort of try and bring together all of these separate documents and sources that we have come up with into a single Word document. and try and circulate it by, say, Monday, Tuesday. And then, unfortunately, we are on a tight timetable. You've seen them individually. Well, you've seen the contents individually, either in emails or separate Word documents. But please try and get this back to us, I guess by January 1st. And then we'll submit it to, I guess we'll just submit it to Peter. Peter, should we be addressing anything else, considering it's the final meeting?
I would refer that question to Representative McCarthy-Wade because I believe she'd probably answer that better.
Oh, sorry, on my screen I didn't see. It
I don't
doesn't
believe
show.
she's here, but I would probably email
Oh,
her
okay,
or
okay, okay.
contact her.
Okay, I thought you meant that she was here. Okay, no, absolutely. So, um, okay. So if there's nothing else, should we end the session?
Can you share that the nutrition document that you have up on the screen with the
Yes,
group?
I just
Because
sent
I'm
it.
curious for other. Oh, great, because I'm
No,
curious.
I just sent it as an email to the whole group.
Thank you.
Okay, and
I don't
I'll
have
try.
anything else.
You don't. Okay, so actually, I'll try and get this to everybody over the weekend, so you'll have a
Yeah.
week or so. All right. Well, it's been a pleasure. I've actually learned a lot. And it'll be, of course, very interesting to see if any of these recommendations actually get picked up. For one, I mean, if I had to pick one, if only one was to be picked up, I would say it's the Liver Health Day. I think that would really, for so many reasons, partly because it sort of opens doors, it's quite expansive when you do that, which means that it may have consequences that I can't even predict at the moment. And also, secondly, it's one recommendation which I don't think will require too many resources. So that hopefully makes it, more likely that it'll happen. So. Okay, well, great. Well, thank you so much. It's a pleasure. Some of you I knew, and others I met just for the working group. It was a pleasure. And although we won't meet, I'm sure we'll have some email exchanges.
Yes. I enjoyed this group and learned a lot as well. So thank you for
No,
the
and thank you
teamwork
for
and the
joining me.
discussion.
Great. All
Yes,
right, everybody.
likewise.
Have a wonderful holiday. We'll be in touch
You
by
too.
email. Take care. Bye-bye.
You too.